Steroids are substances that have become widely discussed in health, sports, and fitness communities, yet many people still misunderstand what they truly are and how they affect the human body. The word steroids can refer to several types of chemical compounds, but in most everyday conversations, people are talking about anabolic steroids, which are synthetic versions of male sex hormones. These hormones, especially testosterone, play a major role in muscle growth, bone strength, and the development of male characteristics. While steroids can be very helpful when prescribed by doctors for medical conditions, they can also be extremely dangerous when misused for bodybuilding, athletic performance, or physical appearance. Understanding steroids and their effects on health is important because their impact can extend far beyond muscles, affecting the heart, liver, brain, hormones, and even mental health. Many individuals are attracted to steroids because of the promise of faster results in strength and size, but the reality is that these substances come with significant risks that are often underestimated or ignored. To understand steroids properly, it is important to first know that there are different types of steroids used for different purposes. The most commonly discussed type is anabolic androgenic steroids, often shortened to AES. These steroids are designed to mimic testosterone, the hormone responsible for muscle development, deep voice, facial hair growth, and other male traits. Doctors sometimes prescribe anabolic steroids to treat conditions such as delayed puberty, muscle loss due to chronic illness, or hormone deficiencies. In these cases, steroids are carefully monitored, and the doses are controlled to ensure safety. However, outside of medical settings, some people take anabolic steroids in large amounts to increase muscle size, improve physical performance, or enhance their appearance. This misuse often involves doses far higher than what doctors would prescribe, increasing the risk of serious side effects. Another important type of steroid is corticosteroids, which are completely different from anabolic steroids. Corticosteroids are used in medicine to reduce inflammation and treat conditions such as asthma, arthritis, and allergic reactions. These steroids help control swelling and immune responses in the body, making them extremely useful in treating many diseases. When used correctly under medical supervision, corticosteroids can greatly improve quality of life for patients with chronic conditions. However, even corticosteroids can cause problems if used for long periods or without proper medical guidance. This highlights an important point: steroids themselves are not always harmful, but misuse and overuse are what create serious health risks. One of the main reasons people misuse anabolic steroids is the desire for faster muscle growth and improved physical performance. In the world of bodybuilding and competitive sports, physical appearance and strength often determine success, recognition, and sometimes financial rewards. Steroids can increase protein production in muscle cells, allowing muscles to grow faster than they would naturally. They can also reduce recovery time after intense workouts, allowing individuals to train more frequently and at higher intensities. For athletes, this can mean improved strength, endurance, and overall performance. For bodybuilders, it can result in a larger, more muscular physique in a shorter amount of time. These effects may seem attractive, especially to individuals who are frustrated with slow progress from regular exercise and nutrition. However, the rapid muscle growth caused by steroids is not without consequences. One of the earliest side effects often noticed is acne, which occurs because steroids increase oil production in the skin. Users may also experience rapid weight gain due to increased muscle mass and water retention. Mood changes are another common effect, and some individuals report increased aggression or irritability. This condition is sometimes referred to as roid rage, where users experience intense anger and emotional instability. These mood changes can strain relationships, increase the risk of conflicts, and negatively affect mental well-being. While these short-term effects may seem manageable to some users, they often signal deeper changes occurring inside the body. Over time, the long-term effects of steroid misuse become more serious and potentially life-threatening. One of the most dangerous areas affected by steroids is the cardiovascular system, which includes the heart and blood vessels. Steroid use can increase blood pressure and raise levels of harmful cholesterol while lowering beneficial cholesterol. This imbalance increases the risk of heart disease, heart attacks, and strokes. Additionally, steroids can cause the heart muscle to enlarge, making it harder for the heart to pump blood efficiently. This condition can lead to long-term heart damage and, in severe cases, sudden cardiac death. These risks are particularly concerning because many steroid users are young and otherwise healthy, yet they may develop heart problems much earlier than expected. The liver is another organ that is significantly affected by steroid misuse. Oral steroids, in particular, pass through the liver and can cause damage over time. Prolonged steroid use can lead to liver tumors, cysts, and liver dysfunction. Some users may develop jaundice, a condition where the skin and eyes turn yellow due to liver damage. In extreme cases, liver failure can occur, requiring emergency medical treatment or transplantation. These risks demonstrate how steroids can affect internal organs that are not visible from the outside, making the danger less obvious until serious symptoms appear. Hormonal imbalance is another major consequence of steroid use. When synthetic steroids enter the body, they disrupt the natural production of hormones. In men, steroid use can cause the body to reduce or stop producing its own testosterone. This can lead to shrinking testicles, reduced sperm production, and infertility. Some men also develop breast tissue, a condition known as gynecomastia, due to hormonal changes. In women, the effects can be even more noticeable, including deepening of the voice, increased body hair growth, and irregular menstrual cycles. Some of these changes, especially voice deepening and hair growth, may be permanent even after stopping steroid use. Mental health effects are also a serious concern for steroid users. While some individuals initially feel increased confidence and energy, long-term use can lead to anxiety, depression, and mood disorders. Steroid withdrawal can be particularly difficult, causing fatigue, sadness, and loss of motivation. In severe cases, individuals may experience suicidal thoughts. These psychological effects highlight the importance of understanding that steroids influence not only the body but also the brain. The emotional and mental consequences can affect relationships, work performance, and overall quality of life. Teenagers and young adults are especially vulnerable to the dangers of steroids because their bodies are still developing. During adolescence, hormones naturally increase to support growth and development. Introducing synthetic steroids during this time can interfere with normal growth patterns and cause bones to stop growing too early. This can result in permanently shorter height and abnormal bone development. Additionally, teenagers may be more likely to take risks without fully understanding the long-term consequences, making education about steroid dangers particularly important in schools and sports programs. Another serious concern is the risk of infection associated with steroid injections. Some users inject steroids directly into their muscles using needles. If these needles are shared or not properly sterilized, they can spread dangerous infections such as hepatitis and HIV. Even when clean needles are used, improper injection techniques can cause abscesses, nerve damage, and severe pain. These risks emphasize that steroid misuse involves not only chemical dangers but also physical risks related to how the drugs are administered. The immune system can also be affected by steroid misuse. Long-term use can weaken the body's natural defenses, making individuals more susceptible to infections. Minor illnesses that would normally be easily treated may become more severe and take longer to heal. This weakened immune response can be particularly dangerous for individuals who are already exposed to high levels of stress, intense training, or crowded environments such as gyms and sports facilities. Despite these risks, many people continue to use steroids because of social pressure and unrealistic expectations about body image. Social media, movies, and professional sports often display physiques that appear extremely muscular and lean. These images can create unrealistic standards that make individuals feel dissatisfied with their natural bodies. As a result, some people turn to steroids as a shortcut to achieve these idealized appearances. However, the physical transformation achieved through steroids often comes at the cost of long-term health and well-being. Another factor contributing to steroid misuse is misinformation. Some individuals believe that taking steroids in cycles or combining different types of steroids will reduce side effects. Others believe that certain supplements can protect the body from harm while using steroids. Unfortunately, these beliefs are not supported by strong scientific evidence. And many users still experience serious complications despite taking precautions. The truth is that no method of non-medical steroid use is completely safe, and the risks increase with higher doses and longer durations of use. Education and awareness play a crucial role in preventing steroid misuse. By understanding the real effects of steroids on the body, individuals can make informed decisions about their health. Coaches, trainers, teachers, and healthcare professionals can help by providing accurate information and encouraging healthy fitness habits. Promoting natural methods of muscle growth, such as proper nutrition, consistent exercise, and adequate rest, can help individuals achieve their goals safely without relying on harmful substances. In addition to education, support systems are important for individuals who may feel pressure to use steroids. Encouragement from friends, family members, and mentors can help individuals maintain confidence in their natural abilities. Building a positive body image and focusing on overall health rather than appearance alone can reduce the temptation to seek shortcuts. When individuals understand that true fitness involves strength, endurance, and long-term health, they are more likely to choose safe and sustainable methods for achieving their goals. And that's the truth about steroids and their effects on health. While they may promise faster muscle growth and improved performance, the risks to your body and mind can be serious and long-lasting. Real strength isn't built overnight, and lasting health always comes from consistent effort, proper nutrition, and smart training. If you found this video helpful, make sure to like this video and share it with someone who might benefit from learning the real effects of steroids. Don't forget to subscribe to the channel for more videos about health, fitness, and science-based tips that help you make better choices for your body. And remember, your health is your greatest asset. Protect it, respect it, and invest in it every single day. See you in the next video.